The state health plan has actually been around for about 8 years. It's required, it's in statute, and it's approved every year by the governor. Traditionally, it's been like most state health plans that are around the country. It's been top down. It said, okay, we're going to cut infant mortality rates by half by 2025. And as you said in your remarks, Commissioner, it's the people in this room that really drive health and prosperity more than our department can. And so what we wanted to do is adapt and provide a framework for people, a set of principles that anyone, anywhere can use to think about health and the way that their job or their focus can influence the health of their communities. So what we did is we created a new framework for the state health plan, and it's got 3 main components. The first component is a set of 3 guiding questions that anybody, anywhere can use to think about how their role on Team Tennessee influences health. Secondly, we're creating an ongoing dynamic repository. Right now, it's living in an Excel spreadsheet, but we have big hopes for it to turn it into a robust online database that you can go in and say, I am a church and I am interested in healthy eating, and be able to pull up whatever information you can find and find examples and samples of what other people across Tennessee are doing. And then finally, we're creating a set of vital signs. How do we know that we're improving health in Tennessee, and what is our health? We're actually right in the middle of conducting a series of workshops across the state. We just did one in Knoxville yesterday, had great turnout. To engage people and hear from them what they think population health is, what it means to them, so that we're creating a relevant set of measures to people to really understand what health is. So those 3 guiding questions I mentioned, they are, number 1, how are we creating or improving opportunities for optimal health for everyone? Number 2, are we moving upstream? Are we going to where we can go in people's lives to prevent disease before it even happens, before it's going to cost us money down the road? And then finally, are we learning from or teaching others? So are we drawing from those who have gone before us to learn from the evidence that they have created? Or if we're being innovative, and sometimes you have to go out and be a leader, are we teaching others as we go so that they can learn from what we're doing? So that repository, we've got a quick little tiny screenshot of it, but it's broken down by places and spaces, by levers, by topics, so you can slice and dice your way to find what people across Tennessee are doing. We've already got a great number of activities and sample projects that people can do based on many different things. And then what we want to do with the state health plan going forward is do a deep dive into all of these different places and spaces. We're starting with faith communities to really engage these stakeholders across the state, understand what health means to them, what challenges and barriers they're facing in achieving optimal health for every member of those stakeholder communities. And then think about ways that the state health plan and all the resources of state government can come alongside these stakeholders to improve their health. And then finally, the last bit of the framework are those vital signs. So those workshops I mentioned, we're asking 2 main questions. 1, how do we define population health? What is it? It's a very big buzzword. If you have any healthcare friends, they're probably talking a lot about population health. But it means different things to different people. So we're trying to get a consistent statewide definition of population health. And then finally, how do we measure it? So we figure out what population health is, what are the different metrics and measures, and what are the data sources that we're going to use. There's a lot of data out there, but it's not necessarily what we want to or need to be able to accurately measure the health of our state. And so one of the things we're doing is we're pinpointing things that we want to know or want to be able to know. And even if we can't measure them today, then it becomes a policy priority of the Department of Health or of state government to be able to gather that data and package it in a way to where community leaders can make decisions on behalf of their communities to improve the health and prosperity based on having all of the appropriate evidence at hand.
All right, good. So vital signs and kind of asking the question, what does the health of the whole population look like in Tennessee, and how do we know if we're meeting that?
Exactly.
And Leslie, you have a long history in metropolitan planning and really active in active transportation, and you joined the Office of Primary Prevention. You're directing that. Can you talk a little bit about why it's important for people with a livability perspective and for health people in particular to be around these tables as communities are thinking about how to make themselves more livable?
Sure, I think it's really interesting when you think particularly about transportation. I worked for about 12 years for the Nashville Area Metropolitan Planning Organization. We have 11 MPOs across the state, and they're the fiscal agents for transportation in our urban areas. In the Nashville area, we had a approximately $7 billion budget between now and 2040, and we were thinking about how are we going to allocate those dollars to transportation projects. But because of all the things we've talked about today, we knew that transportation was having downstream impacts on our health, everything from air quality to injury, but a lot in physical inactivity. And so driving, whether we're in a rural area and we have long distances between our destinations or in an urban area when we're in congestion, really impacts our increasing waistlines and it impacts our mental health. There's also this notion of time poverty. So if our transportation is taking up a lot of our day, whether we're on the bus or we're driving or we're walking, it's taking away from other opportunities we have to be working in our businesses, to be with our families, to be resting, to be recreating. And it's particularly important because a third of us don't drive, either because of age, income, disability, or choice. When we're thinking about livability and we're thinking about transportation and city planning, it's really important that we think about those folks, because if we're designing our streets for just one mode, then we're automatically excluding about a third of us. And I think that's really where public health can come into the conversation, because we can help to think about how many of the decisions we make on a daily basis are having downstream implications on health and how all of our decisions are interrelated, whether they're education or economic development, whether we're looking at parks, whether we're looking at health, and any of the multiple sectors that we have. And finally, really quantifying those benefits, I think, is the next big step for us. So how do we demonstrate to one another that having a walkable community not only has great benefits for our personal health, but our economic health as well?
Really, really good points. You mentioned time poverty, and I didn't mention this in my remarks, but another thing that's really important that we don't get enough of is sleep. And we don't have as much of an evidence base or research base around sleep as we do the other big four. But I think it's pretty clear when we ignore our ancient biology, when we think that because we're Homo sapiens and we have this frontal cortex that kind of wraps itself around that reward center, that we can kind of outfox our ancient biology and do things like look at a bright screen late at night and that won't have an impact, but of course it does. And Martha, you've had a really interesting journey as a physician, now directing a county health department for I think about 10 years,
Close.
And doing some really interesting things. So talk to me a little bit about your journey from because I shared it, but I'm interested in yours. Your journey from hands-on care to population health in Knox County.
Sure. So when I started at the Knox County Health Department 12 years ago, we had a primary care program, we had an indigent care program, and I went there to take care of the under and uninsured and do some prenatal care and some other things. And when I got there, I realized that if we were going to make the impact we wanted to make on our whole community, it wasn't going to be one patient at a time. We had to do things differently. And we looked around our community and found that we had other partners that could provide that care maybe even better than we were, which would allow us to shift some of our energy and money and time to the community and not that group of people. Some of you may have run a clinic in the past. Running a clinic takes a lot of time and energy, and a lot of people as well. So outsourcing that, making sure those folks still get that care that they need so people don't go without care, enabled us to look and do some different things in our community that we hope will eventually, it takes some time, have an impact on everybody in the community, even those folks who are under and uninsured. When we raise the health of some, we raise the health of all. And really working hard with unconventional partners, like transportation, like our Metropolitan Planning Organization. I was in conversation with some friends the other day, both educated women who wondered why I was meeting with the new director of the Metropolitan Planning Organization in Knox County. And it was an opportunity to say, well, we need to be there. Planning for transportation impacts our health, and we need to be part of that conversation. So it's been interesting to learn and to realize that if we step back and treat the community as our patient, helping create those, the environment where people can make healthier choices, not just easy, but automatically. It's got to be to the default, and then it will become a habit.
You're the physician for Knox County. I think of myself as a physician for the state of Tennessee. It's very different to be a physician for an individual versus a physician for an entire population. And things that you might do or recommend for one person, you'll think very differently about when you start thinking about thousands of people or tens of thousands or millions of people. And one of the things that I really admire about what you've done, Martha, is this kind of bold step you've taken into diving deep in your community. And I've shared with you before, but everybody here doesn't know. I had the opportunity to go around to all of our health departments in the first year I was here. And we're like one of the largest providers of outpatient clinical services in Tennessee. We provide a lot of primary care, a lot of prenatal, family care, and lots of other services. And everywhere I went, what everybody was focused on is exactly what you said. You know, how can I provide that, that next unit of care for the indigent population that we're taking care of? Mm-hmm. And that hasn't gotten any easier over the last 5 years. But you kind of dove in. We addressed that with the primary prevention initiative, getting people to think about primary prevention, get outside the walls of the health department, get into the communities. But you doubled down. So tell me about that journey.
So over the last 10 years or so, we again kind of began to focus outside ourselves, move from that model of we know best and we know what your health problem is and we know what the solution is. So here you go, we're done now and you should be healthier, and it's that simple. But we really realized it wasn't that simple, and it's really exciting and fun work to do. But it's really about engaging the community and asking them what they think is going to help them be healthier, and how do we help them achieve that, empowering the community to be part of the solution. We've spent years creating solutions for people that we serve, and now we've kind of changed our posture, and we're really coming alongside and behind even, and saying, we want to be partners with you. Help us understand what you think will make your community healthier. And sometimes it's really simple. In one part of our city, it's a poorer part of our community, has a higher crime rate. There's a greenway, but nobody was using it. And so one of our UT Department of Public Health classes went and did a walk through the community and asked some simple questions about, why doesn't anybody use this greenway? Well, it was a really simple answer. It didn't have lights. But we hadn't bothered to ask. We just were like, well, we put that greenway there and nobody uses it, so we don't need any more greenways. It just didn't have lights. And now it's lit, and I'm hoping people are going to use it. We'll have to go back and look at that. But even simple stuff, like get the trash out of the sidewalk or the debris, yard waste on the sidewalk. So if you ask people, they know. The communities they live in, they know what's going to improve their health and improve their quality of life and their well-being. We just don't always take the time to listen. And it's hard work. It's not as easy as writing a prescription because it takes much more time, but it's worth it.
It's kind of hard to measure some of those diseases that you've prevented.
Yes.
Because they don't happen. Mm-hmm. You can't measure them. Mm-hmm. It's hard to cut a ribbon on kids that aren't smoking because they just aren't. So tell me a little bit more, Eric, about where you think we're headed as a state in our use of vital signs and in the state health plan.
So our hope with the state health plan, Martha, I think you said it great. We're from the government and we don't know best. We often can be the conveners of those people who have the solutions, but rarely do we have a monopoly on solutions. And so recognizing that with the state health plan, what we wanted to do is provide a place to convene people around the issues that are affecting our health and prosperity. But even more than that, equip people with a set of tools that they can use as they're making their daily decisions, whether in a personal or a professional capacity. So, we're all making decisions that have downstream effects. And if we're not thinking about health, if health isn't on the radar, then we're not thinking about a whole area that is going to affect our prosperity. So if we think about each of these decisions that we're making, whether it's as a chamber or as a board of education or a legislative committee, as an investment in health, then we're going to see huge returns down the road. And as government or even as part of a plan, we can't prescribe for everybody what those decisions ought to be. But what we can do is provide some tools that help people make an informed decision to think about, okay, how is this decision going to affect health? Is it going to help us move upstream and avoid some of those downstream costs that frankly we can't afford going forward? Is it going to draw from lessons learned from other people? And are we going to be able to share with others what we've done? And so that's really the vision for the state health plan, is to become a set of principles and a set of tools that people can use in their own place, in their own context, to make a decision that makes the most sense for them in that time and place. But that if everyone is following those sets of guiding questions and everyone is working towards improving those vital signs that we identify, then we're all as a team working in the same direction, and we're providing alignment throughout the network of Tennessee's economy. Lots of different people doing lots of different things, but ultimately sharing a vision, even if they don't realize it, of improving health and moving in the same direction.
And you think about vital signs, and for those of you who don't know, Tennessee gets ranked on a lot of different health parameters regularly. Currently, we kind of pin our vision on America's health rankings, and that's a 27-year-old index of about 39 different metrics, and we're currently ranked 43rd out of 50. We've not been out of the bottom 10 in the 27 years of that index. Part of our vital signs initiative is to really look at what's important to people in Tennessee, and that's why we're going around the state to talk to people about what does population health look like to you, because we're different than other states. And we really have to, as a physician for the population, you really have to meet your population where it is. If you walk into a doctor's office and you say, gosh, doc, my knee hurts, or I got low back pain, the first thing I say to you is, part of that's because you smoke, and those are not very well vascularized areas, and the blood vessels there are narrower, so I'll tell you what, you stop smoking, and then we'll talk about your chronic low back pain or your arthritis. And you kind of look at me like, thank you, I'll be leaving now. You got to meet your patient where they are. So that's what you maybe talk about in the third or fourth visit. That's not the first thing you talk about. But the fact is, it's true. And in doing the vital signs, we have to determine where our population is, and not only at the state level, but at the local and community level, so we can meet people where they are. So let's think about, let me ask you, Leslie, just kind of thinking about your journey from a city planner, somebody who's very health conscious, has young children that you're trying to give a leg up to from a physical activity standpoint. How did you make this move from city planning to working at primary prevention initiatives around the state?
When I first joined the Nashville Planning Department...
Other than the fact that I lean on you. Don't talk about that.
When I first joined the Nashville Planning Department, one of the projects I worked on right away was a grant we had gotten from the Robert Wood Johnson Foundation, working with our local health department here in Nashville. And the grant was really about building active places, and this is my introduction to this. And one of the signature events was walking to school. And through that process, we learned how many children don't have the ability to just simply take a walk to school, and how by taking away that opportunity for physical activity, it was impacting not only their physical health, but their mental health. There's such a strong connection between being ready for school and being attentive and sitting in your chair, and I see this with two young boys at home, and the days that they don't have recess or PE, I can tell a difference. And it's been proven to be linked to academic performance. And so through that opportunity, I learned how city planning, simply how we're making our choices about land use and transportation, impact our health. And in the planning department, we were thinking so much about where are we going to put a business? And then an afterthought was, okay, how are we going to get people and goods to and from that business? But we weren't thinking really holistically about where are those employees going to live, where are they going to get their food, where are their children going to go to school, where are they going to go for recreation. And as we've talked about, all those decisions are really connected. And it's really important too, when we have limited fiscal resources, to think about how much bang are we going to get for our buck if we make a decision. We want it to accomplish multiple objectives. So if you think about the school that's open on the weekends so that residents can use it as a park, or if you think about a street that doesn't just serve one mode, but it serves multiple modes, that's how we're starting to get a lot of bang for our buck. And a lot of communities that are really interested in this, we see across Tennessee communities that want to do greenways, they want to explore having more park space, and some of them are doing creative things where they're doing it for a day. They're creating a little temporary parklet downtown, or a pop-up farmer's market, or they're putting in a little temporary bike lane so they can test it out. They can get the community input and see what that's like, and then they can look at the levers that they have to make those decisions permanent. There are a lot of levers that we have that don't cost us anything, so it doesn't take us any money for a planning department to look at their residential permits and meet with a school system and talk about, these are how many families are coming online, and we're going to have to be prepared for this amount of students. And then we have subdivision regulations and zoning codes where we can engage the private development community in helping build some of the sidewalks, so it doesn't have to fall on government coffers. And then finally, we have resources that are available to us, and sometimes it's not about new money, but it's about thinking of the money we already have that's available to us, and sometimes there's flexibility in that funding. We did that at transportation, where we funded a transportation health study as an example, where we were using US DOT, federal transportation dollars, to fund a health study, to think about how the transportation patterns in the Nashville area were really impacting our health. So sometimes we have funding available to us that has some flexibility that can help us achieve these multiple objectives.
Great. I want to thank all of you. Appreciate your being here and coming all the way from Knoxville. Will you join me?